Good evening, everyone. We're going to get started. First, I'd like to thank everyone and welcome everyone this evening. Appreciate you taking your time out to come be with us this evening. We're going to start with our presentation with some opening comments from Acting Commissioner Carrie Delaney in a video.
Good evening and welcome to tonight's forum. I want to thank all of you who have come out tonight to continue our conversation on People First Care Coordination. People First Care Coordination will offer so many benefits to the people we serve. First, each individual will have their own unique life plan that will look at that individual's goals and areas where they need assistance and design services around what the person wants and needs. People First Care Coordination will also allow for all of an individual's services, their medical services, their behavioral health services, their OPWDD services, and medication management to be done by one entity, and that is their CCO or Care Coordination Organization. Each individual will have their own care manager that will ensure that their services are helping them to achieve their goals. And finally, People First Care Coordination, by bringing together all of these services overseen by the care manager, will help us to become more creative and flexible in how we can meet a person's needs and help them achieve their goals. Our regional offices will tonight be presenting to you and answering questions that you have about People First Care Coordination. I want to encourage you to continue to check our website as we're regularly updating it with new information, and to use a link on our website to our mailbox, care.coordination@opwdd.ny.gov, to submit to us your questions and your feedback. Thank you for coming.
So again, my name is Joan Volpe. I'm the Regional Director here for Region 3, and we'll just do an introduction. So today's forum is all about having a conversation with individuals and families served by OPWDD and providing information to help explain what People First Care Coordination is and what it means for you, your family, and your services. It is our hope that at the end of this forum, people will walk away with a better sense of what care coordination is and the benefits it offers to individuals and families receiving services. We also want to make sure you have time to ask questions today. We'll provide you contact information so that you can ask questions you have in the future. As the Regional Director for this region, I will be overseeing the implementation of People First Care Coordination in our region, and I want you to know that the regional office will be responsive to you. We are working with providers and families to make the transition a successful one. Some background. First, I want to emphasize OPWDD's commitment to all of you receiving services or whose family members are receiving services, that we are focused on making sure people with developmental disabilities have services that work for them and meet their needs according to their preferences. Today, we will explain how People First Care Coordination will help provide improved assistance to individuals and families. People First Care Coordination is being built on a foundation of person-centered planning. Person-centered planning is designed to assist someone to plan their life and supports. This helps people with disabilities to improve their own independence and reach their personal potential. As you may know, in 2015, OPWDD created the Transformational Panel, made up of stakeholders including parents and people with disabilities. The Transformation Panel did a review of the OPWDD service system and made recommendations for how to improve it. The vision that guided the panel is one of seeing people with developmental disabilities as valued members of our communities and ensuring they have the support to live the lives they choose while experiencing good health, growth, and personal relationships. The panel recognized and OPWDD agrees that we must meet the changing needs of individuals and families. We must be more person-centered and focused more on the results of services being provided, that is, the outcomes experienced by the person. This is where People First Care Coordination comes in. People First Care Coordination is a new way of coordinating services for people with developmental disabilities. It is based on the Medicaid service coordination and the work that the Medicaid service coordinators do, but it goes further and it adds to it. With Medicaid service coordination, the services a person gets are listed in an individualized service plan, or as many of you know, as the ISP. One of the biggest advantages of People First Care Coordination is that it takes service planning and coordination to a new level by tying in services from OPWDD, including those listed in a person's ISP, as well as other service systems, such as health and behavioral health care. So, services received from doctors, dentists, behavioral and mental health providers, and others involved in supporting the individual will all be tied into a single plan for the individual, which will be monitored by a care manager to make sure that you are connecting with services and supports according to what you have planned. By having a comprehensive plan, it is possible to understand all the different ways the person receives supports, and the coordination between systems helps make sure the various providers' efforts are working together to meet the person's goals. It will also help people navigate multiple systems and understand their service options better. People's First Care Coordination affects coordination of services, but not payment for these services. So it will have no impact on the medical providers you see now or how they are paid, be it through private insurance, Medicaid, or Medicare. We are interested in knowing the health and behavioral services you receive and your prescription medications, because one's health and family well-being is part of understanding a person's service needs. And so these services can be better coordinated with your OPWDD services. Through People First Care Coordination, families will get more help managing services and can rely on the care manager while still taking on as much of a role in coordinating their loved one's services as you do today. Another way People First Care Coordination benefits individuals and families is the greater focus on outcomes and measuring the results of services on people's lives. Today, we can tell whether a service has been delivered or not, but now we want to go further by using data to ensure that services are having a real and positive impact for people receiving them. Now let's move on to discussing how People First Care Coordination will work in practice. People First Care Coordination will be delivered by care coordination organizations, which are new organizations that are being formed by the IDD providers in our area. The care coordination organizations will be responsible for creating the individual plans, tying in OPWDD services and other services as I described earlier. These are called life plans in the new system, and one is created and updated for every individual served. The care coordination organizations are new organizations. They will be formed and operated by experienced providers of OPWDD services. The care coordination organizations have to be large enough and cover a big enough region to be considered viable and to actually be approved to operate. So care managers. Care coordination organizations will be staffed by care managers with training and experience in the field of developmental disabilities. Current Medicaid service coordinators can be employed as care managers and are valued partners in our transition. Many care managers will be prior Medicaid service coordinators, and most MSCs are expected to transition to care manager roles and keep their caseloads, serving the same people as before. The care manager will take on the task of coordinating services, even if services are provided through different systems, so individuals and families will not have to navigate between service systems on their own. Individuals living in the community without the support of a certified residence for tracking and attending medical appointments, for example, will see the added benefit of this enhanced support. Also, individuals with complex health needs will have extra help tracking appointments and services from a variety of providers. All in all, we expect this change will make people's lives a little easier by improving and enhancing our current system of service coordination. To do their work, care managers will meet standards, including showing skill in developing person-centered life plans. Where current Medicaid service coordinators do not yet have these skills, they will be allowed a grace period so they can receive training to meet the new standards. Agencies providing Medicaid service coordination in the OPWDD system are in the process of affiliating with a care coordination organization. OPWDD is working with providers of Medicaid service coordination and emerging care coordination organizations to ensure a smooth transition. The life plan. Part of the significance of the shift to people-first care coordination and the care coordination organization is that it will offer all individuals a comprehensive plan called a life plan, built around them as a person. The life plan is a person-centered service plan. It will list your supports and your services, like in the individualized service plan you may now have. But it will add in additional services you receive from other systems and community organizations. The life plan will be in an electronic format, so information can be shared more easily with individuals, with families, and with service providers. You will be able to access your life plan through a secure portal if you choose. The advantage of having everything in one plan, beyond just the services a person receives through OPWDD, is that the care manager gets the big picture of support for the person and can help make sure that services are being received and are having a positive impact on the person's life. And providers have up-to-date information about how a person's needs and services have changed. Care coordination organizations, in collaboration with the individual and family members, will be responsible for the development and monitoring of the life plan. Care managers will be a big help with tracking appointments, as well as progress toward goals, and individuals and families will be at the center of the team designing the life plan. Care coordination organizations are based on a model of care management that is known as health home model, authorized in federal legislation to help people with long-term conditions. For this reason, care coordination organizations are also known as care coordination organization health homes. You may also hear them being referred to as an acronym of CCO or CCO-HH. A health home is not a building, but rather a way for organizing how services are coordinated. While I realize the terminology may be confusing, what is important is that care coordination organizations are based on the health home model. Because of that, the care coordination organizations will meet specific standards and provide 6 core services to individuals and families. 1, comprehensive care management, so that the person's services, including those from systems outside of OPWDD, are coordinated in a life plan and supported by a care manager. 2, Care coordination and health promotion is the job of the care manager as he or she monitors the person's life plan being put into action and encourages recommending preventative health measures such as screenings and tests. Health homes are also responsible for managing what is known as transitional care from inpatient to other settings, including follow-up, so that if someone is admitted into the hospital, their discharge planning is addressed and possibly expanded by the care manager. 4. Individual, family, and caregiver support will be provided so that individuals and families have the information and assistance they need to make choices and participate in their own support plans. 5. Health homes are responsible for referral to community and social support services to ensure that using community resources available to all can be part of a person's life plan goals. And 6. The use of health information technology to link services and help members of the team stay connected. Care coordination organizations will be required to work with service providers from different systems to meet the requirements of the health home care management. They will be required to create a network for making referrals to developmental disability service providers, medical care providers, dentists, behavioral health specialists, and others, including school districts. I also want to talk a little bit about People First care coordination fits in with our future plans for managed care. As you know, OPWDD has been discussing and planning a managed care system for some time now, and is prepared to move forward with a specialized managed care model designed for people with developmental disabilities. That last point is very important because individuals and families expect that managed care in the OPWDD system will be specialized to the needs of people with developmental disabilities. Having People First care coordination means the foundation of our managed care system will be person-centered planning. While not a requirement, care coordination organizations can apply to become or affiliate with managed care organizations as we move into the managed care in the future. Some people express concerns that managed care will lead to services being reduced. But the incentive in managed care is rather to have the services be the right ones and the right level of services to meet a person's needs. The full transition to managed care is expected to take 5 years. I have provided you with a lot of information so far tonight, and we will move on to questions after talking a little bit about what comes next. You may be wondering, what do I have to do, given the change to the People First care coordination? The good news is that much of the switchover will happen automatically. Anyone currently receiving Medicaid service coordination today will be at first assigned to a care coordination organization health home. This assignment will be based on the MSC agency that provides your MSC services. After that, however, you will have the option to choose another CCO in your region if you want to. People can also opt out of care coordination services altogether and not receive People First care coordination. But if you opt out, you will still receive coordination through the CCO of only your OPWDD services, without the added benefits I have outlined throughout this presentation. All service coordination, including services for those who opt out of People First care coordination, will be provided by the CCO health homes. In the transition, people receiving OPWDD services will transition to a CCO in their region. Everyone will have a care manager and a team to rely on from the start. We expect no interruption to services provided. So now let's open up the conversation to all of you if you have questions.